Some people are exposed daily to traumas as part of their work assignments. People such as police officers, firefighters, emergency department professionals, and soldiers. So, how do clinicians become competent and develop skills to diagnose post-traumatic stress disorder? Let's watch a video of an interview, pausing the video to identify the skills that are necessary for clinicians to be competent in diagnosing post-traumatic stress disorder. Here is the opening of the interview.
Nice to meet you, Sergeant. I'm Dr. Schwartz.
Nice to meet you, sir.
Can you tell me why you came here today?
My fiance demanded that I make an appointment.
Why was she concerned?
The clinician properly introduced himself to the patient, and the patient responded back politely. We learned it was the idea of someone else who made the appointment for the patient. In addition to that information, however, what other information would a competent clinician gather from this brief introduction? Let's watch this same clip again, this time without sound, so we can pay attention to what we observe about the patient's behaviors. What did we, like the clinician, observe? Well, the patient made good initial eye contact, but broke eye contact frequently to look down. The patient said, "Nice to meet you," but he shrugged his shoulders at the same time. He appeared to have some shallow breathing and some grimacing mouth movements, as we often see in anxiety. He swallows large swallows, as we can see from the movements of his cheeks and his Adam's apple. His affect, that is his facial expression, appears anxious and a bit sad. We see him sigh largely as he prepares to make his next statement. All of this is indicative of anxiety that could be a clue that fits with the diagnosis of PTSD. Video interviews are helpful in part because we can slow down what we see and hear in those interviews and play the segments repeatedly in order to capture in depth what happened. Hopefully, with such exercises, we can learn the practice of recording our own interviews in our own heads, and then in our own heads review what happened. Such exercises help us on our journeys toward competency.